I don't want to say they're losing their city. They've lost their city.
Yeah.
When you have all those businesses pulling out, when you've got addicts using in front of kids that are walking down the street, like Steve said, families, they just want to take their kids to school, go for a nice morning walk, live their life. I'm Flindt Andersen, founder of PAIN, Parents and Addicts in Need. I've been in recovery since 2001, and there isn't much I don't know about recovery. And my mission is to constantly tell the truth about addiction, to make the realities of addiction, recovery, and drug culture known, and to drive awareness and advocate change that ultimately saves lives.
And I'm Jason LaChance, a certified recovery coach with a passion for speaking with others and sharing their knowledge to help others seek recovery and maintain long-term sobriety. And this is the Don't Hide the Scars podcast, presented by PAIN, Parents and Addicts in Need. This is the Don't Hide the Scars podcast. I'm Jason LaChance, here with founder of PAIN, Flindt Andersen. How are we, good sir?
I'm good today, Jason. I'm good.
Well, you're good most days. Come on.
Most days.
Come on, look at you, huh? Come on, if I was you, I'd be good. Well, we got a lot of different topics we kind of want to cover because we've been prompted for discussions we've had here in the office due to some of the awesome guests that we've had on lately. One of those being Steve Adami. And I mean, there was just so many great points that were brought up in that conversation with him. And one of those being, you looked at me after we were done and go, or maybe you even said it on the podcast, but more people think like us than we realize.
Yeah.
Or that we're seeing. And maybe that's just not as vocal as some other modalities, so to speak. Yeah.
I think it's important that we mention that Steve is with Salvation Army in San Francisco and executive director of
The Way Out.
The Way Out, which is a really great initiative. I really look when we get, I'll just say it this way, when we get people out of San Francisco that are thinking more out of the box, and I don't mean to the left, I mean to the right. Sure. Getting back to what's really important here. I think it behooves us to make sure that other people know this.
Yeah.
Because San Francisco gets that rap, for being so far left and so far into let anything go.
Right.
Right. That there are people in San Francisco that want to save their city. They want to give solutions to not only the homeless situation, but the drug addiction part of this. And they're actually doing stuff.
Yeah. And I'm going to put it out here. I don't want to. San Francisco is a left-leaning city, but they're thinking forward, not backward.
Right.
And a lot of I think that's where, your type of thinking, mine, Steve's, the people that work with him, Tom Wolf, Tim Ryan, Dan Carity, all the nameless people that we've had conversations with is they are forward thinking, and it's without the sunshine and rainbows of this, because we've got to pull that, I don't know, it's veil of ignorance away. I mean, I know for me, as I've gotten more and more educated, there was some ignorance, and I don't mean that in a derogatory way by definition. Ignorance, just being unaware of all the information, that's not making the most informed decision or opinions.
Right.
And I just see that evolving. I mean, like you said, even in San Francisco, where there's people, the mayor and other people that have gone, wow, we had this wrong. They've not directly said we've had this wrong, but they've said this isn't the right way. We've got to approach the addiction crisis differently.
Well, yeah, because but again, why do we always have to wait till we're in the bottom of the toilet bowl before we start climbing out again? It just seems that that's the way we in the United States do things.
Mm-hmm.
And but let's take our hats off to the mayor of San Francisco, to guys like Steve Adami and the people that are working with him, because I don't want to say they're losing their city. They've lost their city.
Yeah.
When you have all those businesses pulling out, when you've got addicts using in front of kids that are walking down the street, like Steve said, families, they just want to take their kids to school, go for a nice morning walk, live their life without somebody defecating in front of them. my God, when it gets to that point, well, you better do something damn fast.
Yeah.
And so again, it looks like they're doing it. They're starting. And like you said, more people are leaning, if not completely over to our side that we're talking about. Let's not lose recovery here.
Yeah.
We've basically lost the war on drugs. I don't see that coming to an end in any future. And our last hope here is to make sure that we don't lose our grip on recovery in that process.
Yeah, because and Steve again brought up such a great point, is that in overdose prevention, recovery is not inherent, but in recovery, overdose prevention is inherent.
Sure.
And I'm sorry, it's just, if you disagree with, point of views that you and I share that are about 150 billion% on target with one another, I'm sorry, you're wrong.
Yeah.
Like, it's not, this is a situation that I'm not going to even debate you, and it's not about my emotions and my feelings and everything else. It's like, oh, you want the greatest prevention of overdose? It's called abstinence.
That's it.
I can't get drunk anymore because I don't consume alcohol.
Right.
That's the easiest, simplest way. Or, other people like Julian that we've had on here, a young man that's done fentanyl, has overdosed. He can't if he's not using.
He cannot overdose.
Yeah, it's not going to happen.
It's pretty simple math.
So I just don't get the perpetual logic of it. And look, this isn't the like 60s era pot or something like that we're talking about here. Because pot's not even that pot anymore.
Right. It's not.
It's not benign. I mean, we've had people here on this podcast have a loved one that's had a psychotic break.
Correct. From
the marijuana that they're using with a brain that isn't fully developed. And even then, like, I've been around some people, it's like, ooh, Lord. This is
scary.
Yeah. So
I think there's another piece to this as well. Again, I'm just going to say it. I keep mentioning, dancesafe.org and organizations like them that are there, that they are a detriment to the recovery process. I mean, to me, this is really going to sound something. You might as well take dancesafe.org and all their followers and put them on an island somewhere.
Sure.
And then you guys would go do what you want to do. Okay. But don't inject what you're, I mean, anybody can inject what they want, their beliefs. That's the United States. We can say and basically do what we want. But when you are promoting a method of they're promoting a method of simple drug use. Use the drugs. Quote your big thing, the safe supply. The shooting galleries, the safe injection sites.
The fallacy of safe supply. There's no such thing.
Right. That's my point. The fallacy of it. There is no such thing. I don't understand how people can say, okay, yeah, we're going to put you into a safe injection site someplace. Well, what happens when they leave the safe injection site?
Yeah.
They're going around the corner to pop a vein in an alley somewhere, or going home to the housing that was provided to them by local government. And that's where 71% of fatal overdoses are happening.
Yeah.
So again, there are times when I see somebody's side to the long-term harm reduction piece. And what I mean by that is the 60-year-old, homeless or not.
Sure.
Okay. But have been through 30 years, 40 years of active addiction. And that person needs to be on a medically assisted treatment plan. I don't really have a problem with that, as long as it's done correctly.
Mm-hmm.
Still being drug tested, being monitored, being watched. Okay. but when we're talking about, and I know I keep beating this to death, but that 25-year-old, 30-year-old, 40-year-old, even 50-year-old, to say, yeah, it's perfectly okay to do this for the rest of your life.
Right.
What kind of life are you leading? You're not.
Yeah.
So again, let's lead them towards abstinence. Give them those options. Give them enough time and treatment to be able to get to that point if that's what they want. You can never force anybody to do anything they don't want to do.
Yeah.
But damn it, we're not even giving them an option.
Yeah. And all the information. And that's one of the things when you talk about dancesafe.org, tell me if I'm wrong, but I don't recollect in any of the literature in addition to never mentioning if you're struggling, here's some places to call or information to seek recovery.
That I've seen.
But I don't even recollect it going, hey, if you're going to attend one of our dance events, understand that substances out there are incredibly deadly, and we recommend highly recommend anything like that you don't use because it is deadly and people are dying. But if you are, please at least adhere to some of these practices. Like, it's not even like they're just removing that reality of it or not even acknowledging it. And you need to acknowledge it. Like, quit leaving that part out.
Right.
I'm pissed off because here comes some other kid. Maybe he didn't overdose at your dance event, but then he goes home and he gets Molly that's got fentanyl in it, and he got at that event and he's gone.
Right.
And maybe all he or she, they needed to see was, wait a minute, I can go and enjoy this and I don't have to do drugs?
Mm-hmm. Mm-hmm.
Because I know it might sound stupid to some people listening, but sometimes, yeah, that's what we need. When I was actually my current sponsor, they got a little over 3 years ago. He goes, yeah, you're going to have a whole lot of fun when you're sober. I'm like, huh?
Yeah.
It's like, oh, I guarantee it, man. Just give it a little time and it's going to happen. And he's right.
He's right. He is right.
New Perceptions North, the premier drug and alcohol treatment and recovery center in Central California. A full continuum of medically supervised top quality care with programs for detox and patient residential treatment with dual diagnosis, intensive outpatient treatment, sober living support groups, and more. New Perceptions North provides adult men and women with the highest caliber of professional health care, treating each client with compassion and respect in a safe, comfortable environment to begin the process of recovery to proudly create and sustain a life without addiction. Call 559-978-1507 or visit newperceptionsnorth.com.
There is no doubt that recovery is good, and recovery we have fun, and we can remember. And
there's no apology call.
There's no
text message.
Right. There's none of that. It's yeah. So we just have to do the better job of leading somebody down our path. If they want what we have, we can offer that to them. But there's just it's like I say, we're pushing the ocean back with a broom right now. And like Susan today on the podcast, lost her son. There was a lot of different circumstances in there to the loss of her son, medical and those kinds of things. But here was a young man that appeared, according to mom, that he wanted. He told her, I can't beat this thing. I've tried. And in the beginning, of course, she didn't know where to go. Mm-hmm. So a lot of that information is still not out there. Treatment has a bad rap in a lot of areas in this country. And I think some of it stems from the fact that parents think that one and done, right?
Yeah.
Send them in for 30 days and everything's going to be just groovy again. All right. Well, that ain't the case. But it's the information twofold. The information is not getting out there correctly. there are people out there that are preventing people like us to get that information out there correctly. And thirdly, when that information doesn't get out there, where does the person go?
Mm-hmm.
What do they do?
Mm-hmm.
They grasp.
Yeah. Well, and if you hear this loud thing about harm reduction and harm reduction alone, I can see where it's easy for somebody to get on board. And
You
that's
bet.
dangerous because harm reduction alone is causing more harm.
It is. It is.
And we're not guys like, at the end of the day, my perspective is I'm about public safety.
Right.
Like, I get it. People are going to drink. It's legal. They're going to drug. They're going to whatever. But like when you drive, rob, steal, cheat, that's when I really start to have an issue. Granted, I don't want to see you die either. I don't want to see anyone die from this. I know I can't make that happen. But it really is it's not helping the public safety issue.
It's not.
If it was, we wouldn't have the overdose death rate we do. We wouldn't have the amount of homeless people because it's a huge contributing factor, right, along with other economic things and everything else. But still,
sure,
it's ridiculous.
Steve made a great point. He says when you walk down the streets in San Francisco and you see an encampment there and there's 15 bicycles surrounding that encampment, what, did they go out and buy 15 bikes?
Mm-hmm.
No, they went out and stole 15 bikes. So again, the public health and safety piece of this that's in the crapper.
Yeah.
Because we're not protecting our cities. But I also think this, and this one I think people really need to take a look at. I know we've mentioned this before. When we live in Fresno, and you're up north a little bit, and so for the most part, we're in small areas. We've got a little over 1 million people here, in Fresno and Clovis, and so that's a good size. But we are so spread out that we don't get that visual of a downtown San Francisco or certain parts of downtown LA or the surrounding areas of LA where there are 2,000 people lined up, with tents, along the freeway. We get 2 over here, at Shaw and 41, or we get some, going over the overpasses down 99, so we get a glimpse. We don't see the en masse of that. And so I think that puts us in a position of, well, it's not that bad here.
Mm.
It's not that bad here. But we all know that it's going on in a lot of homes.
Yeah.
In a lot of schools. When I talk to these local high schools, and when I'm talking to parents in particular, and this happened over this past weekend, when a parent told me that their kid's afraid to go into the bathroom at lunch, at one of the Fresno Unified schools. Because their kid walks in there and it reeks of pot, and they can buy pills and they can buy anything they want in there.
Wow.
And there's police on campus.
Yeah.
I mean, so again, we've got those hidden pockets, I guess I want to call them.
Sure.
Where we're just not getting inundated with it every single day like the larger cities. But it sure could lean that way.
Yeah, especially the higher pedestrian type cities, San Francisco, parts of LA, Hollywood, etc., and Oakland. Oh my God,
Oakland's a disaster.
I just went through there. It's a disaster.
Yeah.
And then actually up, because I'm farther, about an hour north of Fresno, and there was an encampment. I would say probably good 15 to 20 tents right off the 99 heading south, just out of Merced, but it was farm area, so I'm guessing they did whatever it took. And then just around the corner from my house, there was a Walter White looking RV, and even my youngest is like, what do they got going on in that thing? I'm like, I don't know.
For those who don't know Walter White, that's
Yes.
Breaking Bad.
Yes,
Yeah, rolling meth lab.
exactly. And there was kind of this area where there was some trees, and I'm guessing whoever the landlord was that owned this land, because there's the prominent coffee shop, a Tractor Supply, and all this other stuff, and they came through and chopped all these trees down and everything else. It was like there was no more hiding. Here you are, we fully see you.
Right.
So, and I think with the smaller areas in those kind of situations might have a little more leeway to do something too.
Sure.
There's not as much of a pushback, or smaller town life, maybe a greater desire for that public safety. Because I'm sure it was brought up. It's
Right.
by the biggest coffee chain in the world, where a dumpster caught on fire. I'm guessing that's not from, the Starbucks person throwing out the garbage.
Right.
Along with, a multitude. My adopted dude, Arthur, was living in this area too. And I think people's eyes are opening up a little bit. But then again, I don't know that conversation.
Mm-hmm.
I don't know if it was as opposed to, wow, these people are really suffering, but we also can't have this in this area for public safety, or it was, you got some darn bums over here, you need to clear them out. I don't know what the dialogue was.
Yeah. Yeah.
My hope is there was some sort of help, because we do have a very good program in Merced County. So I don't know.
Yeah. Yeah. I don't know. Susan mentioned something else today on the show, that she talked about her constant battle with the lack of knowledge from the medical community, in this. And that's an ongoing battle as well. Physicians, for the most part, are good, decent people that want to help. But again, I just got to say, she didn't really tell me anything I didn't know.
Sure.
About the medical community and their lack of knowledge when it comes to addiction. And
what she did highlight that I wasn't aware of is how many, schools to become a medical doctor, and the limited amount of them that even educate in the area of addiction medicine.
Right.
That was pretty eye-opening to me.
It was. I can't exactly remember the number.
Like 180, but it's only 12 or 13 of them. And that's kind of mind-boggling to me, that when you have to do, doctors have to do so much education, and I'm not taking it because I could never be it.
Right.
And know so much that wouldn't be included. Like, how is whatever board you have to go through to get your license, how is that like not a part of continual education?
I don't know. Again, just like when I spoke at that the medical I don't know, convention, whatever you want to call it, the lack of understanding that these physicians had on addiction. Their cure or their resolve for it is, we're giving them too much. We just need to stop it.
Mm.
And they don't go any further than that.
Yeah.
And I'd written something down, which I forgot to mention to her. When you have a situation like her son, who, a lot of this was car accidents and injuries, that this poor young man, by the way, he did pass away from an overdose. But all the medical, things that he went through, it dawned on me that once he was released from the hospital, there was no plan.
Mm.
And I remember in 1976, when I had those series of 4 surgeries, I was in the hospital basically the entire year. And when she was talking about the amount of morphine they were giving him, just took me all the way back. Because in those days, they would give me morphine directly into my hip. This wasn't via IV. This was the whole syringe, okay? And I'll do this just for the sake, because we know we hate to pound on tables here, right? But you could hit my hip, and that's about the sound you would hear. Because after 30 days straight of morphine, I don't know the term, but it just makes your bones and your just like rock solid.
Yeah.
But I remember I was in college and I was living in an apartment, and I remember that they discharged me, and now I'd had all this morphine for all that time, and they sent me home with like Tylenol #3 codeine, which didn't touch it. Excuse me, but I remember going through withdrawal symptoms every time, that I went back, because again, even in those days, I mean, there was never a plan in those days.
Right.
But today, how does a physician not have a plan? How does a physician or a hospital staff not know that we just loaded this patient up, all right, with X amount of morphine or Dilaudid or fentanyl or whatever the hell they're giving them? And how do you just release somebody with a script of 20 pills or 30 pills and say, you're going to be fine? I don't even think it's discussed.
Yeah.
And for somebody that has been in long-term use, even just for medical reasons, we're not going to tolerate that withdrawal symptom. We're going to go get what we need. So there's a lot more of call it unconsciously with physicians and hospital personnel, call it unconsciously not helping somebody. I don't know what the term is. Sure. Okay. But they're unconsciously just letting them go without thinking about what are the repercussions of us letting this patient go when this patient is going to start to go through withdrawal symptoms basically the minute they walk out of that hospital.
Yeah. Well, and that was very eye-opening too in the conversation with Susan, because, she put the effort forth. My son is an addict. He has been in recovery, but this is definitely a triggering thing. He knows he needs to go and get help. Well, that big stoppage sounded like insurance. I mean, she literally says, they called, said, oh, he's already been in once this year. Right. That's all you get.
Right. But see, there's a caveat to that. Okay. And this is where treatment centers can get a bad rap. But what an insurance policy basically says is we're going to pay for your original treatment. And I want to make this so people understand. So I'm going to, again, speaking in layman's terms here, okay?
Yes, please.
If you relapse, we'll pay for it again. So where Susan was, hey, she was being proactive and telling the insurance company that my son is probably going to go out and he's going to have to go through treatment again because he's going to go through withdrawals. She should have just kept her mouth shut and him relapsed and him go into a treatment center and they would have covered it again. Because certain policies will cover it for 2 or 3 times during that year. And again, there are unscrupulous treatment centers out there that will play on that.
Yeah.
And will even contact the person. Are you doing okay? I mean, yeah, it's messy all over the place. Okay. It's messy all over the place. Yeah. So again, when we talk about the Steve Adamis of the world and the good work that they're doing and pushing and leading people to abstinence, and here's a way that we can do this, God, it's fantastic. I'd love to see this. But there are so many more, I don't know if I want to call them angles or problems or situations that we have to cover in order to make this whole thing work. I hope that makes sense. It's just as much of the solutions that we need to offer a series of 4 or 5 solutions to make sure everything's working properly.
Yeah.
And again, that's going to take massive amounts of change in laws, in insurance, in treatment, in the way people think. the way doctors think, the way society thinks about it. It's going to take all of that to make this enormous change. And I don't know if it's even doable. Look, I never want to say the United States and we can't do anything. We can do anything we want. Okay. Yeah. We can fix.
Yeah.
Okay. We can fix. We can blow up. We do it really good.
Yeah.
Okay. We're pretty damn good at what we do. Why can't we do this?
Yeah.
If you or a loved one is struggling with addiction, please call PAIN, Parents and Addicts in Need, at 559-579-1551, or visit us online at painnonprofit.org. Follow us on social media on Facebook, Twitter, Instagram, and TikTok at Pain Nonprofit. And please subscribe to the Don't Hide the Scars podcast and share with others wherever you get podcasts and on YouTube. And if you would like to donate to PAIN, Parents and Addicts in Need, please click the link in the description to make your tax-deductible donation today and help us save more lives gripped by addiction.
It begs the question of, I mean, I already know the answer, so I don't know why I would ask about powers that be actually caring about people as opposed to their agenda, what's good for them, and actually caring about constituents. But we have to invest in our fellow people.
Yeah.
Just at the end of the day, we have to invest in a person like you did with Julian.
Yeah.
Like, you know, and so many other individuals and their family members. And at the end of the day, this comes down to people, like in how we want to treat people.
Right. Right.
You know, because, you know, we can sit and, hey, I'm very grateful for everything I have. I have food in the fridge. Like, my life is blessed. I'm not walking 5 miles each direction to get somewhat clean water. Like,
right.
I'm blessed. But I would hope if I ended up in a situation, knock on wood, there would be people that would be remembered.
Sure.
That it would invest in people. And sometimes all we need is that one person to believe in us. Imagine if we had a culture of people that believe.
That's right. That's right. And again, this isn't a party line thing.
No.
This isn't Republican versus Democrat. This is a human being thing. You know, I don't care how far left you are, how far right you are. You know, this is about getting the right help for those people. You know, but here's the piece on the investment part. Okay. You and I doing what we do, we invest in people all the time. Those people need to invest in us.
Mm.
They need to be able to come in and say, okay, we're going to do what you're asking us to do. Okay. Because we're not asking anybody to do something that we didn't do.
Mm-hmm. And continue to do. Right. We're not asking them to do something stupid. We're not asking them to do something that you and I didn't do in getting clean. So that investment has to be in us. And I have found over all the years of doing this that I would say out of well, let's just put it this way. 20% of people are going to do what we ask them to do the first time. 80% aren't. They're going to be on board for a little while. Then something in their life's going to happen, and then they're just going to fade away. Or, you know, we'll say, look, your kid doesn't need to go back to school for the rest of this year. Okay. He or she needs to focus on their recovery. Okay, we'll do that. We can do it. No, because the rest of the family's going, why isn't he in college? Okay. And then his ass goes back the next semester, all the same triggers hit, blah, blah, blah. The kid's right back in the same damn boat again. You know, so people have to invest in us as much as we invest in them. Mm.
And I think that's an important piece to this.
You know, just us invest in themselves. And
yeah.
And part of that, I mean, like you talk about, well, they got to get back to college. Well, okay, so clearly you want them to learn from a mentor. That's what this is.
That's what this is.
It's what we do.
This is addiction 101.
Yeah.
Is what it is.
We'll take you from A to Z, but you got to get on board and you got to be willing to kind of,
you know. And here's what Steve said too the other day, which I really like, because I've said it 100 times. All right. Nobody knows the addict like the addict. Those of us, I wrote something the other day about Robert Downey Jr. Okay, there was something on TikTok about him, and I don't know, Jimmy Kimmel was giving him kind of
yeah, at the Oscars,
at the Oscars, or you know, for something, and I wrote on there something like, I am so proud of this good man. I said I've got 24 years of recovery. I said, and those of us that have been there are the only ones that truly know. Good for him, you know, kind of a thing. And that is such a correct statement. I don't care who you are. I think Sigmund Freud did cocaine so he could understand what his cocaine clients were going through.
Sure.
You know, and he did enough to kill a small herd elephant. But and Steve said that the other day too. You know, he said, nobody knows the addict like the addict. And I'm now I am not the only one saying that lawmakers and everybody else associated with this has to start asking us that are in long-term treatment or long-term recovery, what works and what doesn't.
Yeah.
Because obviously we know for a reason.
Yeah. Yeah.
You know,
and I think one of the other things in you know, jumping back to the medicine side of it that I had brought up in that conversation with Steve Adami was okay, you want a doctor involved, we'll make sure it's an addiction medicine specialist.
Yeah. Not your GP.
Yeah.
Not your ortho.
Someone that studied it. I mean, we had not that long ago, Darren Prince on, who Dr. Drew Pinsky, it was like, hey, so you're in recovery. How's that going? Oh, I've been on Suboxone. Well, for how long? And I think he said it was near a year. And he goes, oh, no. And he took him on then as a client.
Right.
And we're not sharing it. This is something Darren shared so we can talk about. We're not breaking HIPAA or anything here.
Right.
Because this is a man that has done this for 30-something years, that went out, educated himself, worked in the centers first.
Right.
And worked his way up then to being in charge of some, and then clients in recovery, of which he still has many.
Right.
In addition to all the other stuff. But you give us a specialist. You want us to have these conversations with doctors, give us a specialist.
Right.
And if you're not a specialist, come sit with the specialist. Hear it there if you don't believe us.
Right.
Ah.
I know it's frustrating, but then again, you look at how many addiction specialists are there out there? Not many.
Yeah.
Not many.
Yeah.
You know, some may claim to be, but even okay. Without me getting too in depth, there are physicians out there that I have worked with over the years that have that addiction specialist credential, but they still don't know the addict.
Right.
They're going to follow what the medical guidelines are, and that means putting everybody in the same category. So let me just dive into that a little deeper. If we're both going in for substance use disorder for opioids, and I've been using for 25 years, and you've been using for 10 years, they're gonna probably detox us in the same way as if we were both at the 10-year mark. I got 14 more years than you do in that. My detox has to be different because of the length of time, the amount of drugs that I was taking as compared to you. So because they haven't studied, I'm not going to say they haven't at all, but it appears that they haven't studied the addict. at different phases of one's addiction. I mean, that's what it appears to me.
Yeah. So my question that never occurred to me to ask you this till now, what does a doctor, someone shows up at a treatment facility, what is a doctor's role in that?
The first thing that happens is obviously the client comes in and we do a full evaluation on, vitals, blah, 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 drug tests, see what's in their system, on and on and on. And then the doctor will do either in person or FaceTime with the client. And again, just ask a boatload of questions, all right, on all about their substance use, where it started, what they've taken, how much, what's the method of ingestion. And it just goes right down the line from there. And again, depending on if it's alcohol or if it's benzos or if it's opioids or if it's cocaine, even though insurance doesn't pay for cocaine withdrawals, which just shocks the out of me, doesn't, or methamphetamine either. Then the doctor makes the determination there on what's the best protocol for that. Do we do Suboxone for 5 days? Do we do Suboxone for 10 days? And that, and then it starts to be tapered down almost immediately, with that. And again, I'm going to go off the reservation a little bit here, because I believe that there are certain people that have been using for longer periods of time that need longer than 10 days, for the Suboxone taper. I really do. It just stands to reason.
Yeah.
I
don't think that's off the reservation or derivative of anything else that you've said upon here.
Yeah.
We're not talking.
Well, because I don't want, look, a lot of times when we talk about abstinence on here, people are going, oh, you're just a hard ass. Okay. And you want to get them in there, what, you're going to, detox them in 2 or 3 days and they're going to go through hell. And no. That's not what we're talking about at all here. Okay. And people need to be aware of this, that this is life and death that we're dealing with. Okay. We're going to detox properly, right? We're going to do it as, and especially we have to do it under what the doctor's protocol is. We can't overshoot the doctor on this. But I know this one. Okay. It's not even about how long you keep them on. It's about how much you keep them on to where they're comfortable. If you're going to bring somebody into detox, you might as well keep them comfortable during this time, because if they're not, they're going to run. Nobody wants to go there to go through hell. You're going to go through enough of it once the drug is out of your system, and now you're starting to learn to live again. That's where the hell comes in. Because now you're learning how to do things all over again. That's the tough part.
Right.
That's the tough part. But again, a lot of treatments, our hands are tied because of the insurance companies.
Sure.
You've got doctors on the insurance side of it going, no, I'm sorry, we don't need to detox this kid for another day or two. He should be fine by now. And that's where you have treatment centers fudging, going, no, he's showing signs of this or he's showing signs of that. Because again, they're not talking to the people that are there. It's just what it is. Mess.
Yeah.
You have to beep that one out.
It's all right. But it is at the end of the day.
At the end of the day, it's a mess.
And again, that's the investing in people. We're invested in someone that is a mess, but doesn't have to stay that way.
It doesn't have to stay that way.
Yeah.
It just doesn't. But like we said earlier, look, one of the issues is, when somebody walks through these doors, not only the addict has to listen to what we have to say, but the family has to listen to what we say. Every Wednesday night, I have to tell people, I'm not here to be mean. Okay. This doesn't give me any joy to tell you that these are certain things that you have to do in order to make sure that your loved one is going to be able to be somewhat successful at this. It gives me no joy to tell them, that you have to cut them loose or you have to not pay for their cell phone, or you can't feed them, or you can't clothe them, or you can't, buy their car.
Yeah.
But we know what works. It's and I hate the term tough love. I really do.
Yeah.
There's nothing, I just
I just think it's love.
it's just love.
Yeah.
Okay. It's because we parents and families have to get out of the enabling mode.
Mm-hmm.
That's all.
Mm-hmm.
So again, this is going to take the whole choir.
Yeah.
You know?
It does. And I think that has to, and I've talked about it on here before, was one of the disservices with my dad's recovery was that there wasn't any of that work ever presented for myself, my brother. My mom may have gone to like Narcanon or something. I don't know. I would have to ask her. We don't really bring it up. I don't think poor lady was put through hell, so I don't think she likes to revisit too often.
Right.
Don't blame her. But helping them understand it's a disservice to them to not embrace it as well.
It is.
And be a part of that. Because it's going to hurt. The hurt's going to be there.
Hurt's going to be there.
But you might as well embrace some things that are going to help that hurt turn into something prosperous.
You bet. You bet.
Anything else, Mr. Andersen?
I don't think so, man. I think this was this was a good couple of days. Getting this message out there. I really love what Steve Adami is doing up there. And again, I want to give a shout out to Susan, who we had on today. It's
that podcast is out as of last week. We're recording on the same day because we had so many things we wanted to converse about.
Yeah. She's a neat lady. And I just hope she continues.
Yeah.
She's in North Carolina. And I think a lot of this stuff has to be taken state by state. It really does, because every state is different in how they address this issue. I think if we ever wait for the federal government to come in, we're going to be waiting until hell freezes over. And is she right in saying that it's who we vote for? Yeah, it is. But she's in North Carolina. We're in California.
Yeah.
It doesn't seem to matter who we vote for.
Yeah. Some of those areas we're going to lose the battle before we even get a start.
Right.
I don't know how else to put it.
I don't know how else to put it, because we've really gotten nowhere. I mean, think about it.
Yeah.
I mean,
as far as a state.
As far as look, I mean, from the law enforcement side, I think we've gotten better.
Oh yeah, I mean, Fresno's an example of that.
Fresno's
with the Fort Division that is
great example,
become modeled around the country.
Correct.
Now.
And what DA Smitkamp has done, as far as prosecuting these dealers, I mean, absolutely. But the treatment side of it, we've gotten nowhere.
Yeah, we need to figure out a plan that clearly the way out is utilizing that works with the experts, works with treatment centers for them to be profitable and have as many available options.
Yep. That's what we're shooting for.
Yeah, I just don't know why this isn't being treated in the continuum of care like any other issue that a doctor-patient relationship will try to face.
Right. Or, like we talked about today, and that we're working on, is making that little slight move down south.
Yeah.
To where we can get somebody that's got a face and the name that's going to raise holy hell.
Yeah.
On this thing.
Yeah.
Because that's what it's going to take.
Yeah.
That's what it's going to take. It's going to take somebody of some extreme notoriety to come in and go, WTF. All right, boys and girls, it's time.
Yeah.
Because we're losing more people than we need to.
Yeah. Agreed. Mr. Anderson, anything else?
That's going to do it, man. We covered a lot of stuff today.
Yes, sir.
Thank you,
Jason. Thank you. And we thank you for watching, listening on whatever platform you're on. Please subscribe if you haven't already. Share, keep spreading the word. That's how we see that nice uptick in listenership, as we don't do any external advertising of the podcast other than social media. And so thank you for listening to Pains Don't Hide the Scars. And if you want to find out more about that Wednesday night meeting that Flindt was talking about that he runs, the link is in the podcast description. You can join us by Zoom if you are not in the Fresno area.
If you or a loved one is struggling with addiction, please call PAIN, Parents and Addicts in Need, at 559-579-1551, or visit us online at painnonprofit.org. Follow us on social media on Facebook, Twitter, Instagram, and TikTok at Pain Nonprofit. And please subscribe to the Don't Hide the Scars podcast and share with others wherever you get podcasts and on YouTube. And if you would like to donate to PAIN, Parents and Addicts in Need, please click the link in the description to make your tax-deductible donation today and help us save more lives gripped by addiction.